Okay, so I was asked to give a BBC today about a meeting that I went to just last Thursday, and I joined 5 other people to meet with from this interfaith group called Faith Action Network. It goes by FAN, and this is a statewide group that is striving for just, compassionate, and sustainable communities through courageous advocacy and public action. So this week, that organization has had people across the state, including clergy, lay leaders, monastics, meet with their representatives in Congress or their staff. Um, they they got together with United Church of Christ, their Office of Public Policy and Advocacy, and they made a training. So I went to 2 training sessions that taught me how to meet with Congress people. And through that, we had this meeting. And this was part of an effort called the Moral Budget Advocacy Week, because the Congress was voting on the budget for the country this week. So this was an effort related to what's going on in Washington, D.C. So we met with Representative Baumgardner's outreach director, Andrew Rolls. And Representative Baumgardner is in his first term as a congressman for the 5th District of Washington. So he's actually serving 10 full counties and parts of 2 counties in eastern Washington. So my reason in going, once I learned what the issue was, actually was to just speak for my concerns for Pend Oreille County. And that's what I spoke about. But basically, this was an effort for a very specific action item, which I think the person there appreciated. It was not like a real broad thing like go in and save the world. It was, no, we want you to do exactly this, and here's why. And so basically what we were requesting was that he would work quickly for a bipartisan extension of the Affordable Care Act enhanced premium tax credits. So what the heck is that? So basically, there are people who don't qualify for Medicaid because they earn too much, but they don't have enough money necessarily for private insurance. There's a whole network called the healthcare insurance market that you can go to on the U.S. government site and figure out, wow, how can I get help with healthcare? What's possible? And part of that, so we're talking here about people who are working generally, pretty much working and don't have enough money for private insurance. And this is how they're able to have healthcare. And the open enrollment for this comes up on November 1st. And because this extension to this tax credit has not gone through yet, it wasn't part of this budget that just didn't pass, but it's not part of that at all. It means the whole thing would end. And what does that mean? Well, what it means already is that the insurance companies are planning for this, and they've already raised their rates like 21% in this state. So this is actually critical for nationally for millions of low-income Americans to pay for health insurance. And without these, there are like 4 million people that are estimated that they would drop off these policies because their premiums would go up like $100 a month. So the background for this is for Faith Action Network, is also that Congress has already cut billions of dollars to Medicaid and SNAP, which is the food stamps program, this last summer. So there's already been these cuts. And their belief, their statement is, our nation's budget is a moral document, and Congress chose to give tax breaks to the wealthy few at the expense of the rest of us, including the most vulnerable in our communities. So this is where they're coming from. You may or may not agree with that, but let's just think about it for our county. And these are my thoughts based on what I've seen. I worked in healthcare for 30 years. I remember when Clinton was in office and there was this, what they called these cuts to Medicare that had what they called unintended consequences. I was working in a hospital setting then. All kinds of programs got cut. It was kind of considered a mess, and they realized that, and that's what they said about it. Also, in the years that I worked, I never saw one person in all the years I worked as a physical therapist who didn't have health insurance. Not one. I did do some volunteer work once at a community clinic for people that didn't have insurance, but I never saw anyone. So I'm concerned about actually the working people in our county, because we aren't a rich county, we're actually rather a poor county. And so people, I think, will have a lot of potential to lose their insurance. There are over 300,000 Washingtonians who are enrolled in this marketplace insurance that we're talking about here, and 70% of them receive this tax credit. And I would say that in our county, it could be higher than that, higher than 70%. So this is what allows people, like maybe a business owner who's, doesn't work for a big company, to have health insurance for themselves and their families. So at this point, they're saying that the insurance carriers are already projected to raise their rates by 21%. And so when I was looking into this morning on some of the information, because I wanted to just learn more all about this, more than our county, there was actually a calculator that I could go on that would say how much more would people pay in premiums if the ACA enhanced premium tax credits expire. So it was like I could put in, I could decide like how much you earn and this and this and this. So I put it in for somebody who is earning $40,000 a year, which is $19.23 an hour, and then has 3 people in their household. I'm thinking of young people who maybe have an infant and a mother staying at home and a person working. And actually, I have to say, part of the reason I went to this is because I've met a lot of people in the trades, and not very many of them have health insurance. Even some of them that are older, people that have worked here, I know that are like in their 40s and 50s, actually don't have personal health insurance policies. So to me, this is quite impactful for what can happen. So for that person, for that family of 3 with 1 child and a household income of $40,000, this was based on projected, this calculator was updated on September 12th, 2025, so it's current, essentially. If they wanted to, they have 4 categories in this market insurance healthcare thing: bronze, silver, gold, and platinum. So the silver is not as good as gold or platinum, right? So if you were to get the silver policy, that family's rates would go up, it was $140 a month. How many people do you know who are raising a family can afford $140 more a month? When already we're aware in this county, and other people that were in this meeting with me, that people are actually struggling with food insecurity in this county even. So how are people going to afford insurance when they are actually struggling to afford food? So basically, if you have interest in this and you want to look into this, please do. This is the time to make a difference. You can actually, if you want to write your senators, there's actually a really easy way to do that right now. The United Church of Christ has a homepage, and they have this section on it called Action Alert, Protect Affordable Healthcare. You can go into that and you can actually change the letter. I changed mine from Christian to Buddhist, and you can change the whole text of the letter. And then it automatically will send it to your senators. And the reason I think they're sending it to the senators is because I think they're going to be the next group that works on this. But we basically, if this is something that you care about, now is the time to do something, because unless something is done, these rates will stay up. Then when November 1st comes and an open enrollment comes, people will be opting out, and there will be a lot of people in this state and in this county and in this country that won't be having health care for themselves and their families.